AHLA is pleased to present this special series highlighting the top 10 health law issues of 2022, where we bring together thought leaders from across the health law field to discuss the major trends and developments of the year. Support for AHLA in this series is provided by PYA, which helps clients find value in the complex challenges related to mergers and acquisitions, clinical integrations, regulatory compliance, business valuations and fair market value assessments, and tax and assurance. For more information, visit pyapc.com.
Hello, my name is Jane Jerzak. I am a partner or a principal with PYA. I'm here with Porvi Manar, and Porvi is a member of Norton Rose Fulbright's healthcare transactions and private equity teams, and is a partner based in the firm's St. Louis and New York offices. She focuses on bringing together various types of transactions involving private equity portfolio companies. Porvi is passionate about improving access to and quality of behavioral health services in the United States. She represents private equity companies and prominent nonprofit behavioral health providers in connection with their mergers, acquisitions, strategic partnerships, and clinically integrated networks. She also advises hospitals in connection with restructuring their inpatient behavioral health programs, as well as telebehavioral health providers and other clients focused in the behavioral health space. She is also the chair of AHLA's Behavioral Health Practice Group. Welcome, Porvi. We've got an interesting topic to discuss today, as you wrote an article entitled Behavioral Health Transactions Outlook for 2022. A lot going on in the behavioral health space. So let's get right into it, Porvi. Can you describe for the audience the key behavioral health impacts related to the COVID-19 pandemic? What are we dealing with today and why?
Thank you, Jane, for that kind introduction. And yes, so much going on in behavioral health. It was already such an active sector before the pandemic, and given the pandemic's challenge to our collective mental health and well-being, as well as other factors such as issues related to racial injustice across the country that caused severe strife and disruption, natural disasters, and issues in national politics even. The level of mental health issues generally has skyrocketed in the last couple of years, and overall 37% of Americans are reporting anxiety and depression, which is about a 235% increase from years prior. So that really is very noteworthy. But breaking that down, we are seeing that young people 18 through 29 have been seen as struggling the most with both mental health as well as substance use issues. We have also seen pediatric mental health emergencies on the rise, so under 18 all the way, down to early teens and below. In fact, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association about a couple months ago jointly declared a national state of emergency in children's mental health, issuing a call to action to policymakers. And obviously, a lot of this is due to the isolation, the stay-at-home orders, lack of in-person schooling, and the stress, of families trying to maintain jobs and careers while kids are schooling from home and unable to engage in all the activities they used to. As well as other factors. And also, as we all know, healthcare and other frontline workers have been disproportionately impacted due to the stress of having to deal with wave after wave of patients and overflowing emergency rooms. And minorities and socioeconomically disadvantaged populations have also been disproportionately impacted. And so it really is a critical time in behavioral health. Luckily, we're seeing a lot of progress, both from a market and regulatory standpoint in the space.
Boy, what you're describing, Porvi, is really a pandemic within a pandemic.
Absolutely.
So, as you describe the implications, the consequences, the demographic groups impacted, how would you say the market has responded to this mental health pandemic?
We have seen a lot of increase in market activity. It was, like I said, already a very active sector as far as growth of availability, mergers and acquisitions and partnerships in the sector, all with a view to increasing access, both through in-person as well as telebehavioral health services. Couple notable examples: Alira Health, which provides comprehensive mental health services through EAPs, employee assistance programs. As you know, we've seen a big increase in the availability and emphasis on those. Alira raised around $200 million in its latest funding round, bringing its valuation to over $2 billion in order to accelerate the delivery of mental health benefits for companies with employees around the world. Global investment giant KKR announced the launch of Geode Health, which intends to build a new platform to offer in-person and virtual outpatient mental health across the United States. LifeStance, which is another provider of in-person and telehealth mental health services across the country, completed its IPO in 2021. And in fact, in 2021, we saw more than double the number of transactions completed in all of 2020 in behavioral health, coming close to around 300 transactions. And that's in addition to a variety of other collaborations and new models across the country involving competing hospital systems, behavioral health providers at the community level, as well as private equity-backed and national nonprofit providers and government agencies coming together to collaborate and form, consortiums and affiliations to address a shared problem that impacts both the quality and costs of care across their communities.
Wow. So there has been quite a bit of activity, as you've described, in the market space, both in terms of transactional as well as innovation. So with that as a backdrop, how has the government responded to this mental health pandemic? Regulatory changes, funding changes, what's happening within our government?
Great question, Jane. Much as they did with the pandemic as a whole, the government responded as expeditiously as you could expect them to in putting measures in place to expand reimbursement and availability of telebehavioral health. This included expansion of reimbursement, waivers of originating site requirements, so patients could access telebehavioral health services from their homes, waivers of HIPAA requirements, which allow the use of telebehavioral health via FaceTime. We saw state medical boards across various states loosening restrictions on providers licensed in one state who were willing to deliver services to patients in different states. On the reimbursement side, the Mental Health Parity and Addiction Equity Act, MAPIA, has been the law of the land for a couple of decades now and requires parity across behavioral health coverage and medical surgical coverage, but both interpretation and enforcement of MAPIA has been uneven and challenging for many payers in many states, since its passage. And we've seen the clarifications and strengthening of parity requirements in the last couple of years, including under the Consolidated Appropriations Act of 2021, which added requirements for group health plans and issuers to prepare and submit written analyses, where they have to demonstrate at a pretty granular level their methodology for how they achieve parity between reimbursement for behavioral health and medical and surgical care. And based on the initial findings from these requirements, the initial analyses and compliance audits that were recently completed, we're already seeing plans changing their practices, including removals of exclusions for medication-assisted treatment for opioid use disorders, removal of coverage limitations for urine drug testing for mental health and substance use disorders, and removal of other clinical criteria limiting mental health and substance use benefits. So we've seen quite a lot of progress, and given the bipartisan support for behavioral health, there's quite a lot in the pipeline as well.
As a follow-up to that, Porvi, what do you think in terms of the continuation of some of these items of flexibility, the waivers and so forth, especially in the telemedicine space?
Good question. I think that's a general question that we are asking across medicine and healthcare is what's going to happen after the public health emergency? Will there be continuation? Should there be continuation of reimbursement for telemedicine? And I think the answer is different in different settings and different specialties. But with respect to behavioral health, where there are these large rural shortages of providers, and where a physical exam is typically not required, and allowing patients to access telebehavioral health from their homes makes them feel more comfortable, given sort of the stigma and the hesitation that is decreasing, but still there in relation to accessing behavioral health services. We are optimistic that the pandemic has been an effective testing ground of sort of the increased access and effectiveness of telebehavioral health services. And so, I think key stakeholder groups are pushing to make the availability and reimbursement permanent following the public health emergency. And I'm optimistic that we'll continue to see availability of reimbursement as well as coverage for telebehavioral health services. I think we may see more of a challenge in terms of or some lack of uniformity across state licensing boards in allowing practice across state lines. But there, are interstate medical licensure compacts and other avenues where we are seeing progress in that respect too.
Well, that's great news. That is great news. So let's turn now, Porvi, to looking at two key themes in the behavioral health space that we're all learning more about. One is the value, the benefit of integration of behavioral health with physical health. So we're seeing that as a theme. And then you've spoken regarding the market consolidation and given some examples of major consolidation in the behavioral health space. So if we look at the themes of integration with physical health and market consolidation, What role do you see private equity playing in these two themes as we're further learning about how to be more effective with behavioral health care?
Such an interesting and rich question, Jane. Both integration as well as consolidation, in my view, are so important to advancing this field. Integration of behavioral health with physical health enhances the understanding of the whole person, and allows them to be treated much more effectively than if we were, treating the physical conditions in isolation from co-occurring mental health or substance use disorders. And there have been numerous well-established studies by renowned institutions that have shown that treating behavioral health alongside with physical health, both in emergency room settings as well as inpatient and outpatient settings, can achieve remarkable improvements in quality of care that's delivered, reduce inpatient stays, increase patient satisfaction, and a significant amount of cost savings. So I think integration is critical to the advancement of both behavioral and physical health. However, to get there, because the behavioral health provider market is still very, very fragmented, we need a lot of investment in infrastructure, in best practices, in uniform compliance plans, in professional management, in behavioral health, electronic medical records. And I believe that the more established players, both publicly held companies such as Universal and Acadia, as well as private equity-backed companies, as well as large national nonprofits like Hazelden Betty Ford, can all play a key role in bringing together the smaller practices, the individually owned facilities, and make that investment that is required to provide uniformity, achieve compliance with privacy and third-party reimbursement regulations, in order to partner with hospitals and health systems and traditional providers of healthcare, and help them integrate the behavioral health services into the physical care that they're providing.
So, Porvi, do you think private equity and this related market consolidation will help us as a country get to this needed integration faster?
I think that is one of the forces that that will be very helpful. Yes, I think another way that hospitals and health systems could do it is by directly investing in providers, in behavioral health providers in their community and bringing them in-house. So I think we will likely see a lot of both happening, including, even increasingly training primary care physicians to do behavioral health screenings and integrating behavioral health providers into primary settings so that there is an integrated experience that could hopefully be delivered to patients on an as-needed basis.
And what about the restriction on integrated health records? With behavioral health records, I believe there's additional limitations on the sharing of records. Is that restriction going to be a barrier for having us integrate physical and behavioral health?
Another great question, Jane. As you know, the SAMHSA regulations governing the confidentiality of substance use disorder patient records, sometimes known as 42 CFR Part 2, have much more stringent requirements than HIPAA for the use and disclosure of behavioral health and substance use disorder records where there is federal funding. So, if an organization receives Medicare or is even tax exempt and provides substance use services, they are governed by 42 CFR Part 2. And we have seen some loosening over the last several years of the Part 2 requirements, recognizing the new, more integrated, value-based care delivery models, as well as the need to integrate behavioral and physical health. We're now at a stage where behavioral health records, substance use disorder records can be shared via a general patient consent for treatment, payment, and operations. And I'm optimistic that we'll continue to see progress in that respect, because it is important. But, there will also need to be a balance and a recognition that, unfortunately, there is stigma around behavioral health. People worry about how the sharing of those records may impact their employment or have law enforcement concerns. And so as long as there's stigma and those types of privacy concerns, there'll need to be this balancing act. But we are absolutely seeing progress in that respect as well.
Well, that's good news, because we do need to get there for successfully caring for these populations. So that's great news. Let's move forward. We're moving past a bit the pandemic. We're moving into more of an endemic or kind of a sustainable view. So if we think about where we are with the pandemic, what would you see the post-pandemic behavioral health or telebehavioral health world look like, and why?
I think, I'll pull out my crystal ball now and start to make predictions, but I'm optimistic that we'll continue to see a lot of integration and a lot of consolidation. But I think one impact of the consolidation and the increased governmental and commercial reimbursement that will be accessed through the consolidation will be increased scrutiny and increased focus on compliance, understandably, whereas you had smaller behavioral health facilities and providers, many of which were dependent on self-pay for the most part, often flew below the radar, but large private equity-backed players and other deep-pocketed consolidators that receive significant governmental and commercial reimbursement will become attractive targets for federal enforcement of the False Claims Act. In fact, since 2013, so well before the pandemic, at least 25 private equity-backed healthcare companies paid settlements in excess of $570 million for alleged violations of the FCA. And behavioral health companies may be at greater risk for enforcement compared to other healthcare services companies, because there's been a history of inappropriate practices in this sector, and there is now the availability of special legislative tools specific to behavioral health, such as ECRA, the Eliminating Kickbacks and Recovery Act of 2018, that the government can use and has started to use to ensure that there's practices with respect to referrals and utilization are in compliance with applicable regulations. On the bright side, the larger players in behavioral health have both the resources and the right incentives to invest in pre-acquisition diligence, to see where there may have been historic problems and root those out, and to invest in sound compliance programs and practices post-acquisition. And so I'm optimistic that there's really this great opportunity to raise the bar for quality across the behavioral health industry as a whole. So that's on the compliance side. On the The parity side, I think, will continue to see progress in enforcing the parity requirements that were passed recently. The Department of Labor, Health and Human Services, and Treasury have asked Congress to strengthen enforcement authority in several ways. For example, by providing authority to assess penalties for parity violations, or expanding authority to recover amounts lost for wrongly denied claims, and expanding permanent access to telehealth and remote care services. On the telebehavioral front, as we previously discussed, hopefully the pandemic has been a useful testing ground for the effectiveness of telebehavioral health services. And so we'll continue to see those expand. And in light of the growing pediatric mental health crises, there have been several bills that have been introduced to Congress that are intended to improve students' access to mental health services and provide funding for suicide awareness and prevention. So I think the outlook for additional consolidation, integration, and legislative changes is bright, particularly on the legislative side, given the broad bipartisan support for behavioral health.
That's excellent. And just a follow-up question, do you believe that the increase in reimbursement rates and kind of the organization that we're building around behavioral health will increase the supply of psychiatrists and other behavioral health providers?
I think that is a necessity, Jane, because there is such an undersupply, and that was before the pandemic. We had 40% of counties across the United States that didn't even have a licensed social worker, largely in rural areas. I do think that increased reimbursement, increased awareness, increased demand, and the increased value we place on our mental and behavioral well-being will help hopefully motivate and incentivize more medical students and other qualified professionals to go into behavioral health. But I think that is something that will take time, obviously. But I think that, yes, we'll see progress in the right direction.
Excellent. Well, Porvi, this has just been a very enlightening discussion regarding the issues and opportunities with behavioral health care as we see it today. Any final concluding comments for the audience?
I think we've covered a lot of ground. I think much like the overall acceleration in telemedicine trends that resulted from the pandemic, that progress we've seen in behavioral health, including increased access to telebehavioral health and early attention to pediatric mental health, really represents some of the silver linings of this tumultuous period for healthcare in the United States. And I'm optimistic that all of the recent market and regulatory advances in behavioral health represent significant overall progress towards closing the gap in an area of healthcare that has been historically misunderstood and neglected. So going back to the silver linings, I think, these are some of the silver linings of the last couple of very challenging years that we have had.
Thank you. Thank you for your insights again, Porvi Maniar. Thank you, audience, for listening to this podcast. Again, my name is Jane Jurzak. Thank you.
Thank you, Jane.